Happy International Infection Prevention Week, Kerry, which we know is a global initiative dedicated to raising awareness about the critical importance of IPC. So how's your week been so far?
Yeah, well, happy International IP Week for you as well. It's so lovely to come back and do a clinical conversation. It's been a while, haven't we? It's been a bit rusty, but it's nice to come back on a very special week for many of us. Yeah, it's going really well. I think most of us are, trying to juggle the day-to-day workload. So I think that's the true embodiment of International IP Week, isn't it? You do the doing as well as you try and get the opportunity to go out there. And I was speaking to some colleagues yesterday, one of my meetings, and they had some fantastic T-shirts. I was very jealous. So I think next year that's what I definitely need to get. But so most of what we've been doing, getting the communications out, particularly celebrating the 4 pillars of UP. I've been frustratingly, well, not frustratingly, but sort of in the introvert trying to come out of trying to disappear from me is I did some Instagram reels for our One Gloucestershire. So yes, hopefully those won't be in my view because they are slightly painful when you're trying to do those, aren't they? But it's all good fun. So trying to get some of those messages out. But yeah, what's been really great though this year, isn't it, Jude, is that we've got some of our own resources and assets from the IPS, which we have in the background. I've been sharing those out for my for some of the webinars that the Southwest have held, and it's been lovely to see some of my colleagues using the new Teams backgrounds. So yeah, fantastic that hopefully people have been using the posters, the social media assets, and some of the Teams backgrounds and things. So it's great to have those resources available. So yes, I've been using those this week as well. Amazing. What have you been doing, Jude? I know you've had a little bit of time off, which you're allowed to occasionally have.
I'm celebrated by taking the week off, which is great. Lots of great moments for the kids, which is great. I just wanted to do a big shout out to Gina Hill, who's pulled all of our comms assets for this week. She's done a tremendous job on that, so thanks, Gina.
Yeah, thank you.
And I think you're absolutely right. This is about honouring IPC expertise, amplifying IPC voice, and just a reminder that infection prevention does actually save lives. So it's great that message is getting out there. And I don't know about you, Kerry, but I absolutely love the strap line, Stand Up, which actually has 3 Ps if you've not noticed already, which I absolutely love, which is Unite, Prevent, Protect and Prevail. So I think, Kerry, it'd be great if we could just chat through what some of these words mean to us and how we've been using those in our own organisations and stuff. I'm just going to keep talking because I can't stop.
We love it. It's all good.
Around Unite, and there's the APIC, which is where the stand-ups come from, another society in America, says Unite, many roles, one goal, protecting patients and providers. And when I was thinking about this, for me, it was all around sort of how we celebrate and recognise that every role counts. And I think, when we think about this can be from your porter to your professor. Like, absolutely. There's such a range, isn't there, of people working in infection prevention. And actually we stand together as one team, one huge team, around one standard, which is our infection prevention standards, and think about those patient journeys. And I think bringing those together really, for me, stands out as that Unite. And I think you probably agree, Kerry, that IPC is more than just clinical. When you think about your estates colleagues, I know you do a lot with your procurement, your catering, your portering, your admin, your domestic. They're all really essential, aren't they, to infection prevention? Absolutely. So it takes our clinical and non-clinical staff working together to stop infections. And I really want to do a shout out for those non-clinical staff as well. Particularly our cleaners, domestics. Absolutely. Really true heroes, aren't they? They save lives really quietly, not really realising the massive impact that they make to preventing infection.
What, just to echo what you've just said, is the support that we have also across all different facilities. I think sometimes IPC very much feels like it's in the hospital, and actually that's not the case at all. When we unite, we're uniting across all boundaries, with all systems, with all partners, without boundaries. They're all our patients, they're all our clients, they're all our kind of the people that we look after, our community. So I think, just making sure that when we're valuing the whole system of people that interact, our public health colleagues, you know. And I think reiterating some of the things that we've seen in that with our fantastic vet colleagues and our dental colleagues as well, is that, you know, you have to blur those boundaries that have been there for a long time, that, you know, actually this is a One Health approach. So yeah, we need to all unite together to make a difference if we're going to, you know, have the impact we need on antimicrobial resistance.
Yeah, and I love that across borders, and that reaches across, you know, the globe as well. You know, I was in Romania week and a half ago, working with colleagues there, you know, on their conference, and, you know, and actually understanding the fact that some of their challenges are exactly the same as our challenges, and actually we can pull together and help each other out across the different societies. So yeah, I love that across border work, and uniting is fabulous. Okay, so let's talk a bit about prevent then. So when I was thinking about this is, well, actually, we'll go back to the strapline that APIC have got for theirs, which is taking action today to prevent and save lives tomorrow, which again, a very powerful strapline. And I think the more I think about this, I think we need to be thinking more about sustainable infection prevention, and I mean that environmental. So we're protecting people, but also our planet. So, and I know there's been lots of movement within the UK where we are working, you know, more closely with our sustainability colleagues, but I think we need to do much more of that, our sustainability, our planetary health colleagues, to really make a bigger leap into this agenda. Because I think, and you may agree, you may not, the IPC can really facilitate this, the sustainability agenda. And there's lots more that I think we can do. And you've been involved in quite a lot of sustainability work, haven't you, Kerry, in your area?
Yeah, absolutely. And it kind of aligns with thinking about what you're just saying about protection, actually, which is the second P, well, the second P in it, because I think protect to prevent come hand in hand. And I think you've hit the nail on the head, because I think if we can prevent some of those infections, we can protect the planet. So yeah, we've been really lucky in Gloucestershire, and actually across the southwest. I think we're very lucky to have Graham was working in Graham Pike, who's our sustainability SIG lead in our region, and was really inspired with some of the hard work that he's done. And it filters down. And I think what we've learned with some of the partnership work that we're hoping to do with RCN, aren't we, coming up, is to do these sort of small interventions that might have big impact if we can all do them. So hopefully we can kind of look at sort of case studies. I know things people doing couch roll and how to improve field gate tiger bins, and theatres and ED are big game changers, where if we can improve some of the sustainability impacts in there, we know we can have a big difference. But we know if we can do things better, we can often prevent the infection and save the planet at the same time, which is fabulous. They're normally enablers of one another rather than barriers, which is, I think, what people traditionally would think.
Yeah, absolutely. And I think you're right in terms of, you know, just sharing that we are doing a little bit of partnership working with the RCN, because actually we share these messages to one another, and we're kind of preaching to the converted. And what we need to do is get this message out to the front line. And so we're really keen to partner with other organisations, different professional groups, to try and get that message through to those that are working outside of infection prevention, and where we're already kind of on the same page, aren't we? And I think with when I was thinking about sort of the different prevent and what are the critical things for me, I think, you know, antimicrobial resistance, you know, if that's not a reason to prevent infection, then I don't know what is. This is our silent pandemic. And I think if we can really prevent the infections, obviously people are going to need the antimicrobials, and I think to do that, you know, it links back to our fundamentals of care, absolutely essential to prevent infection, our mouth care, our hydration, you know, preventing healthcare associated pneumonia, our UTIs, not just in acute settings but also in community. You know, I think those fundamentals are absolutely essential, and how we get those that are working with sort of patients outside of the acute setting, you know, like our social care, how do we get those involved in those fundamentals of care, and understanding the link between the fundamentals of care and preventing infection. Lots and lots to do in that space, I think, but really, really critical.
Yeah, you're spot on, and it's a thing that gets me out of bed in the morning. If I'm honest, that's why, because I'm an infection preventionist. Like, the control bit is the bit that we've kind of lost the battle a little bit, but it's fundamental part of our role. But that's the bit that gets me energized. It's the thing that gets me enthusiastic. I'm a preventionist. That's what I would like to do, and that's why I want to try and make a difference to the people in my community. So I think it's definitely. I mean, it's the heart of our society as well, isn't it? So I think it's definitely great that that's having its spotlight. And I think that's why a lot of people come to infection prevention is to do that. And obviously it wouldn't be without, it's the time of year for very big impactful prevention strategy in our vaccinations. A lot of us, I mean, I know it's all year round, but a lot of us will be having our flu vaccines, and those that are okay meet the criteria to have their COVID vaccines as well. I'll be having that. So, and that's critical prevention to keep our our patients, the community safe, but also our loved ones and ourselves. While a lot of people are experiencing quite particularly poorly. I was having a conversation the other day and saying people are really experiencing quite unwell patients at the moment with some of the respiratory viruses that they're seeing. So yeah, we should all do our bit to kind of keep ourselves well, but also prevent some of those, hopefully those transmission events that could affect more vulnerable people.
Yeah, absolutely. In my head, I was thinking about we were looking at some of the epi around the flu rates, and obviously we see a nice line going up, which you'd expect at this time of year. But then you see the spike in hospital admissions as well, and you just think, wow, if we could just get more people vaccinated, how many of those admissions could we avoid? And the massive impact that would have on our healthcare at the moment would be just, the impact would be massive, wouldn't it? So I think when I was thinking about, okay, if I could give sort of 5 top things to prevent, and you can go first if you want, Kerry, like what would they be? Like if you could give somebody 5 tips on how to prevent, what would they be?
Good question. You've put me on the spot there, haven't you? You might need to help me. I think my biggest thing is those fundamentals. I think you've just described. I think it's those. I think sometimes we don't realise the value of those. Good oral health, good mouth care. Making sure that people have good hydration, people are up and moving, those sorts of things. I think if we can think about having those right, will prevent some of those urinary tract infections. We can prevent hopefully patients being admitted with pneumonias. We can then prevent the C. diff infections because we're not giving them the antibiotics that they didn't need. So I think if I can give anyone it's fueled my kind of passion, I have to say, because it's a slightly different stance on infection prevention that's probably more traditionally seen, and I've seen my team flourish with doing some of those more fundamental aspects, and it means that you often get more people on board. You get more of a slightly different team to work with, and it's really something that's tangible that any area can take it. So it's not a nuanced practice you do in acute care. It can take into mental health. It can be taken to community hospitals. It can be taken to social care. So it's a win-win for all prevention if we do that. So that's I think probably takes about 4 things in my prevention if we just looked at fundamentals of
absolutely. And I think mine were around more back to basics, I suppose, which is like clean hands at the right moment, use your PPE correctly, keep the environment clean, clutter free, and speak up if you see a risk, and just stay up to date with your vaccines and your training.
Absolutely.
So I think all those together are great top tips. So thanks.
So hopefully people looked at our posters actually, because that's what we put in our posters. So hopefully people have those on display, because there's some really nice top tips on there, and they're quite nice visual. So again, thanks to Gina for that one. But definitely get those out.
And I think it's great because there's one for IPC, but then there's one for the wider healthcare setting and healthcare professionals. So you can actually decide which one you want. So do look at those. They're on the website. Okay, so Kerry, talk to me a bit about Protect.
Yeah, I mean, I know we've kind of briefly touched on it. I think they go hand in protection and prevention tend to go hand in hand, isn't it? But I think when we talk about protection in like at least in the acute setting, it's about how we either protect people when we've identified patients with infections. How do we protect others? How do we stop that onward transmission? And we know there's fundamentals and things like isolation, good use of PPE are really critical in that healthcare environment. But they're simple messages that we can all take through, and hopefully we're constantly communicating those to our visitors. So making sure people don't come into hospital or visit loved ones when you are you have experiencing any symptoms, respiratory viral symptoms, making sure you're not coming into hospital if you had diarrhea or vomiting, and making sure you're staying away until you've been 48 hours clear. And as staff, we have a responsibility, healthcare workers, we have a responsibility to ensure we're following that same guide, recommend, well, what we should be doing in terms of keeping our patients and our colleagues safe. And then thinking about things more widely in terms of a protection, of saying before about sustainability and how we can, prevention will help us protect sort of our future antimicrobial, the antimicrobes that we currently have, preventing of resistance. There's all little, I think with protection and prevention, there's often little things you can all make a difference, isn't it? Even how we use a sink, how we're using that effectively, so we don't risk contamination of those sorts of things. So yeah, I think what was nice about, I think, protection is that there's a wider aspect of things that we can all do every day to keep ourselves safe and keep our loved ones safe and our patients safe, but also that will have a greater impact on Earth and the protection of Earth from a sustainability point of view, and keeping modern day healthcare running as it is. Because if we don't preserve those antimicrobials, and we don't, we make sure we align with those good antimicrobial stewardship processes, if we don't do that, we're not going to have the modern day healthcare that we currently have. So we will protect our current way of life if we invest in some of those protection and prevention strategies now.
Yeah, absolutely. And I think one thing I was thinking about was, you often see a self-preservation with Protect and IPC. And I guess my one challenge to people is to actually let's protect our patients. And actually, if we do things to protect our patients, we often will be protecting ourselves as well. Rather than, self-preservation, you put gloves on when you don't really need them, etc., miss your hand hygiene moments. So yeah, I guess that was my only sort of other thought around
really
that.
Good shout out there. Yeah, absolutely. Definitely need to be thinking of that slightly different mindset, aren't we? Yeah,
for sure. And then Prevail then.
Prevail. Well, I have the nice one at the end, don't you? Prevail. I mean, and that's, I think, in a nutshell, is celebrating the amazing work that professionals in IPC do, and then also the professionals and healthcare and social care workers that do good things in IPC every day. It's sometimes easy to get lost in the kind of day-to-day challenges, and your head's down and you just crack on, don't you? And that's, it is probably one of the characters of an IPC practitioner, that we just get on with the job, and sometimes that can be go on ahead a bit sort of thankless at times. And I think what we're trying to say, look, is celebrate successes, share those successes, even more so, because often people can go away and replicate those. I think what came out really nice and strong in the Journal Club, in the IPMC partners work that we did after conference, is really sort of celebrating the amazing work that was showed at conference through the speakers, or for the abstracts, for the presentation, the oral presentations, and the posters. Please do go away, think about how you might publish that work. That's the way to celebrate the amazing work that you've done, but also to spread to others, and then hopefully that becomes an evidence base that other people can go away and do. And that's the thing, as IPC practitioners, I think we have a responsibility to constantly contribute to the evidence base, and we need to be better at it. We were good at just cracking on and doing it, and not always sharing that. And then again, also with Prevail is be proud of that work. Go and apply for awards. Go away and have a think about our IPS awards. There's lots of other IPC related awards. We talked about that at our last clinical conversations. So yeah, don't be too sort of humble at times. We need to shout out about the amazing work that we're doing and do that. And actually, what was lovely in the digest to see some of those reflections of some of the award winners and some of that amazing work being shared. So it's really great to see that. So we do encourage you to go and have a little read of those stories, because I think, if anything, those are little things you get inspired and think, oh wait, I can go and do that in my environment and the organisation that I works in. Yeah. How about you, Jude? I think it's probably
I think I think you're right, it's about celebrating, but I think I want to take this moment to those that are listening and watching this, is to celebrate you just for being interested, for wanting to take part. And
absolutely,
I'd encourage you to celebrate those that are working outside of those clinical roles that are actually making a massive difference with infection prevention and control too. Say thank you to your cleaners that have that they're making a massive difference. Tell them that they're saving patients' lives, because they absolutely are. So yeah, really keen to get that celebration message out there, but for the wider healthcare system too.
Completely agree.
It's been great as always, Kerry, to chat with you. Hopefully we've managed to spur some discussion points in your own teams. And if you have any other topics you want us to discuss, just let us know, and we'll bring that to the next clinical conversation.
Yeah, and please do engage. We've now got our fantastic new Instagram page now, which is fantastic to see. It's been lovely to see videos and little images actually come up on my Instagram reels from the IPS. So if you do have stories that you can celebrate your up moments, then do share them, and don't forget to tag us in. It'll be lovely to listen and read some of your experiences and how you celebrated International IP Week as well. Thank you, guys. We'll see you all soon.
Take care. Bye.
Bye.